In August 2016, the Associated Press released a statement that claimed that flossing isn't effective. This idea that flossing doesn't matter stems from the new dietary guidelines put out by the government. Every 5 years, the U.S. government releases new dietary guidelines to Americans, and this new set of guidelines did not mention anything about flossing like it had in the past. People quickly assumed that this meant that flossing wasn't important anymore, and that the government had changed its stance on flossing. According to the American Dental Association, the U.S. Department of Health and Human Services released a statement a few days later saying that flossing is still essential to good oral health. The study conducted by the Associated Press was also discredited. However, now there is a lot of confusion, and Americans are buying into the idea that flossing isn't very effective. Right now, I'm studying to be a dental hygienist, and I am interning at a dental office. I can tell right away whether or not someone flosses because their teeth look so good if they do floss. In my speech, I will be discussing the importance of flossing and why we still need to floss every day. If you already floss every day, this speech will help you stay motivated to continue this good habit. If you don't floss very often, then this will help you improve. And if you don't floss at all, it's never too late to start. And so many people don't floss because it seems like an extra thing to do, which was true in my case. But now that I have started flossing, I'm never going back. I love the improvements I've seen in my gums. So, in my speech, I will explain what flossing is and why it is so important, and I will also be explaining what happens if we don't floss. And then after that, I will teach you guys how to floss, because there's no point in me persuading you about the importance of flossing if you don't know how to do it. So, first off, I will explain what flossing is. Flossing is done using a thin cord of filaments that you string in between your teeth to remove food and plaque. And this little string gets in the places that your toothbrush normally can't. So a lot of people think that flossing is just to remove food that is stuck in between your teeth. That's not the case. There's microscopic bacteria that builds up in between your gums that you can't see with the naked eye, but this bacteria can build up and cause plaque if it is not removed. And so the floss gets in there and breaks it up before it can do any damage. So a lot of people don't know about that, and so they go around living with tons of bacteria just rotting their teeth, and it's not very good at all. Plaque, like I said, is a massive bacteria that is built up in between your teeth, and if it is not flossed out, then it hardens and turns yellow or brown and turns into a harder form of plaque called tartar, and this must be removed by a dentist. So flossing breaks up the bacteria before it can do any of these damaging things. So, like I said earlier, flossing affects the look of your gums and teeth. They look cleaner, less stained, and your gums look healthy. Flossing also keeps your breath smelling fresh because honestly, a lot of the times, the reason your breath smells is because you have rotting food in between your teeth. So, overall, flossing is a great confidence booster. And the main purpose of flossing is to break up that bacteria that could be damaging to your gums. So what happens if you don't floss? Well, for one, it causes cavities. The bacteria, acid, food debris, and saliva that just is in your mouth all the time sits on your teeth and forms plaque. And the acid in the plaque rots your teeth, creates holes in your teeth, and that's how you get cavities. According to modern dental complete care, if you brush your teeth but don't floss, it's the equivalent of only washing 70% of your body. Gross. There are also some more serious consequences of not flossing, such as gum disease. So the most mild form of gum disease is called gingivitis. And this is characterized by bleeding and inflamed gums. So a lot of people think that when you floss, it's normal to have bleeding, which honestly isn't the case. It's actually a sign of gingivitis. But you guys don't need to panic. If that is the case when you floss, it is easily reversible. You just have to start brushing properly and flossing, and your gingivitis should go away within a week. But if you do not take care of your gingivitis, then it will progress into a worse form of gum disease called periodontitis, which is the loss of bone and gum tissue that hold your teeth in place. This causes you to experience extreme pain and even causes you to lose the tooth eventually. So Some signs and symptoms of gum disease that you guys should be aware of is bad breath that won't go away no matter what you do, red or swollen gums, tender or bleeding gums. When it hurts to chew food or you have loose teeth, that's also a sign of gum disease. And also receding gum line or teeth that look extra long, that's not normal. So those are things that you guys should be aware of. If you see any of those, make sure to go see your dentist and get on top of that. There are also other health problems connected to flossing, or the lack thereof, and that includes heart disease. And that kind of seems like a disconnected area of the body. You know, flossing is all in the mouth. How can it affect my heart? And the truth is, the bad bacteria that sits on your teeth and gums, when you have gingivitis or other gum disease, your gums are bleeding. So the bad bacteria mixes with your blood and gets into the bloodstream. And if it sets up shop in your heart, then it can damage it and affect your heart disease. So flossing really does improve your health. It helps prevent very serious diseases. Simply taking 60 seconds to floss can help prevent gingivitis and loss of bone and gum tissue. So after explaining how important and effective flossing can be, I'm now going to show you guys just how you're supposed to floss. So there are two main kinds of floss. There's wax floss and unwaxed floss, and both of them are equally effective. So if you're at the grocery store and you want to pick up some floss but you don't know which kind to get, it's really just a personal preference. They both work great. But if you have extra tight teeth where like you often try and floss and the floss breaks, there's a specific kind of floss that you should get. When I am shadowing the dental hygienists in this dental office, and I start noticing that they're trying to floss in between these two teeth and the floss keeps breaking because it's so tight there, they often pull out Glide floss, the brand Glide. And right away, just whoop, it goes right up there and there's no problem. So if that's your situation, go pick up some Glide. But if you have braces or you really just don't like using floss, there are other ways to clean your teeth. And these include water picks, pre-threaded flossers, tiny brushes that can reach between your teeth, or rubber pointed tips. So now I'm going to teach you exactly how to floss. Here's my generic brand floss. Any floss works great. You want to get about 18 inches. So this is more or less 18 inches. Seems a little excessive, but it really does make a difference. And you want to wrap it around your middle finger and your ring finger and pull that tight until you have just a little bit. And then you're going to hold that in between your index finger and your thumb. And you want to pull it tight. And then you just find a spot that you're going to remember. And you want to keep this spot as the starting point every time you floss. That way you never miss a tooth. So you stick the floss in between your teeth and you just make little C's like this.
She does.
You just move in between your teeth like that. So also, it's important that you floss before brushing your teeth because when you floss, you get rid of the bacteria that's blocking certain points of your tooth that would normally be reached by the toothbrush. So after flossing, and you brush your teeth, you are completely cleaning your mouth, and it's great. So to summarize, flossing does make a difference. It prevents you from getting gum disease, cavities, or even heart disease. It improves the look of your gums too, and it helps you feel more confident. I encourage you all to take the extra seconds to floss every day. This simple act can prevent greater problems down the road. If I still haven't convinced you to floss, that's okay. You don't have to floss between all your teeth, just the ones you want to keep. Thank you.